Welcome to BW Healthcare World. If there is one segment that has grown extensively in the past few years, is that addressing the infertility space. With the new age lifestyles, this is continuing to rise. To discuss about infertility and the assisted reproduction technologies and about the IVF industry, I have with me Dr. Nitiz Murdia, the co-founder and director of marketing and embryology at Indira IVF, one of the leading chains for IVF in India. So, Dr. Nitiz Murdia, thank you so much for joining us on BW Healthcare World. My first question to you is that you have more than 100 centers and half of those are in tier 2, tier 3 cities. Now, how do you choose where to open a new center?
First of all, thank you for having me on the platform. It's an absolute pleasure. So we have a certain criteria in place which exist in the organization. There are a lot of variables when we try to open a center, but we have a database in place. So basically, just to cover a few of them, the first and foremost is the population of the city. The second being the geographical location of the city. And we have done, infertility awareness camps across, across the country, free infertility awareness camps. So we have that database also. So we take that database also into account. Also, patient visiting to our already centers, we capture their PIN codes. So based on that, we also get an idea that, which particular city the patients are coming from to our existing center, and if there is a need and demand of that particular city to have another center of Indira IVF. All these roles, all these variables play a bit of picture, plus other aspects in terms of where our centers are placed and where do we see a need and the demand. And obviously the city grows, the population grows, the demand grows, the awareness grows. So all these factors decide, in which city we want to open our next center.
So, tell me one thing, Dr. Nitiz, that while, when you started Indira IVF, there were companies which were coming in, but they were not looking at setting up chains. It was a infertility specialist who would come in, set up their own clinic and maybe, build up a small operating around themselves. But how did this idea of opening up a chain of IVF centers across the country come to your mind?
So two factors. The first, just to address to specific doctors opening specific practices, I think there was a lot of convention. It's not just for IVF, but just in healthcare there exists a convention that doctors have to be very technically aligned to do a certain amount of procedure, right? Which may not be true for IVF, may be true for some specialties. But what we figured out in the first 3-4 years, that IVF is a very simple procedure if broken down into particular parts, and then we can set up a SOP and a protocol around that, and it can be replicated across the doctors, and it doesn't require too high level of expertise. So just to tell you that a doctor who does a training at our center for 3 to 4 months is able to give the same IVF success rate at a new center compared to a doctor who is 10 years in the organization. So we have tried to break that down into segments, make a SOP, make a process, standardize the whole system, and then replicate it across all the centers. So that is one of the levers that has really helped us. The second thing is, when we opened a center in Udaipur, there were patients coming to us from all parts of India, right from Jammu to Kerala and from Gujarat to the Northeast, right? And then we realized that the patient have to stay here, come here, 2 to 3 times, stay for at least 15-20 days, and they were facing a lot of trouble and problem. So that is when we decided that, because we feel that such kind of treatment was not available in their city or at the cost level that we were offering, and the success also and the technology also, we thought that let us go and branch out, let us go and open centers across the location so that people coming to Udaipur does not face this problem, and they have the same facility, the same success, the same standard, the same level of quality being given in their district, in their city.
According to you, how big is the infertility burden that we are facing in our country? How big do you think is the ART, which is the assisted reproductive technologies market in India, and what segment of that market is Indira IVF addressing?
Okay, so the last report available is the Ernst and Young report, which is pretty old, is 2015. So as per them, the total addressable population suffering from infertility is around 3 crores. And out of them, only 1% of the population go for the ART treatment, which is any ART treatment, assisted reproductive technology treatment. Now, the figures must have changed definitely. What I feel is that, if I see the last 10 years how things have changed, first is the awareness levels have gone really high up. The acceptability of the ART treatment again has gone higher because the taboo which existed in the society has gone down to a very high level, and people are ready to accept that they are unable to conceive, and there is a medical problem, not a social taboo that I am not able to conceive because there is a problem with me. So that has changed. The third thing is affordability. The IVF cost, if you look at 10 years back to now, the IVF cost has come down. The affordability of people have gone up. So I think with growing time, there was a recent report by Allied Services, which came in 2019, where they have predicted that the number of cycle that is happening now compared to the number of cycles that will happen after 5 years, it will just double up for IVF. So I think the market is huge. India is a very under-penetrated market compared to the West, and there is a huge scope of growth. The CAGR predicted by them is somewhere around 16% for the next 5 years. In terms of Indira IVF, so when we started, we thought of that any technology is only good if a common mass can afford it, right? So we changed, or we made the whole treatment affordable in 2011 when we started doing the first IVF treatment. That time the cost of IVF treatment was somewhere around 3 to 5 lakhs. We brought it down to around 1.25 to 1.5 lakhs, right? Just to make sure that people are able to afford. So in terms of our patient population, it is will be lower middle class and lower middle class mainly.
Okay. So, how big is Indira IVF today? I mean, when did you start, and what is your market share in the industry, your revenues, profitability, and also the team size? How big have you become?
So we started in 2011 with one center in Udaipur. Then we expanded. The second center was in Pune in 2014, and then we thought we should be in the capital. So we opened in Delhi in 2015, and then that is how we started opening centers. So by 2019, we were at 50 centers, and now we are somewhere around 112 centers as of now. Um, um, the whole idea of opening center, as I discussed, was to reach out to people and get the same level of care and fertility treatment in their city. But what we wish to do going forward also is to have an Indira IVF center in all the districts, so that patients don't have to go out of the district. They can avail the same quality treatment in their city and place. Um, and in terms of the growth and everything, I think we are very well placed in the north and the west, and we are planning to expand in the south and the eastern market as of now.
So, what's your market size in terms of revenues and profitability, if you'd like to share?
Yeah, so I think market size, we will somewhere be around 12 to 15% of the market share. Revenue wise, I think we'll touch somewhere around 12,000 crores as a revenue for this financial year. Last year we did around 960, partly affected by COVID, almost 1.5 quarter, I think.
So, is it 12,000 or 1,200?
1,200.
Right, right. Uh, the ART segment is growing. It's an aggressive growth. We see the burden increasing every year. What do you think are the large contributors to the infertility problem in our nation?
Lots of them. I think first and foremost is the environment that we are living in. It's getting polluted day by day. I was just seeing how the Delhi air quality has, really gone bad in the last few days. It affects infertility to a great extent. There is a lot of pollution, what we eat. There are a lot of pesticide chemical which affects infertility. The radiation levels have increased in the last 20 years. You see these Wi-Fi's, Bluetooths, mobiles, radiation towers everywhere. So the whole radiation level has increased for the human race. Um, what has changed in the last 5 to 6 or 7 years is that the marriage age of females, especially, which used to be around 22 to 25, has now increased from 28 to 30. And soon I am seeing that it is going above 30. Now, when it comes to female, the egg quality plays a major role in terms of the pregnancy or the fertility rates. As the age increases, the quality of the eggs decreases and the infertility rate increases. So if a person is marrying late, also the career orientation has come into picture. People want to first become something or achieve something in the career and then go for the childbearing. So the childbearing age has increased compared to what it was or what it used to be 5 to 7 years back. So combined all these factors, I think the overall infertility rate, which used to be around 10 to 12% a decade back, is now at 12 to 15%.
A lot of infertility issues emerge out of stress. I mean, like you mentioned, that the environment as well as the lifestyle changes that we have seen in the last few decades are leading us to stress. Do you think that managing mental stress should be a part of the infertility treatment being given at the infertility centers?
So I think what kind of patient come to us is basically patients who have undergone multiple basic treatments with gynecologists, because gynecologist is always the first point of contact when it comes to infertility. And then once they fail there, they will obviously come to a fertility or IVF center. What we have seen is the couples are mentally drained, they are physically drained, they are emotionally drained, and they are financially drained. These are all the four things that we see in the couple. A lot of people lose hope after that, and we hear people saying that this is the last one that I'm trying. If I am not successful in this, I will give up. And a lot of patients tell us that we have had treatment for 8 10 years, then we just gave a break. We didn't want to continue anything, but now somehow we realized that we should do it. So in our centers we have a psychologist counselor available at the center, who will counsel the patient on these emotional and psychological needs. We have seen a lot of difference it brings in. A psychologist counselor who just doesn't talk about the pricing and everything. He just talks about what are the issues being faced by the couple, their family, what are their expectations, how a treatment like this can meet their expectations. So I think it's really helping out, especially for us. And I think there is a need for a psychologist counselor to be available at the clinics.
Awesome. Now, do you think that infertility is being given its due importance, keeping in mind the hockey stick rise that we are seeing in our country? What is your expectation from the policymakers and the government on this? Because like we hear a lot about cardiology, we hear a lot about cancer, but this is an issue that everybody is facing today. Do you think government is doing enough? If not, what do you expect?
So it's a very important and very special question, I would say, because for a country who has a population of 130 to 140 billion, we are trying to provide fertility treatment to increase the population further. So I think the government focus is not there in terms of infertility, because they have bigger health issues to focus than compared to what it is. And if you see the amount of births being born through a IVF treatment in US is around 1%. In India, it's obviously lower than US. So the amount of people getting born through IVF is also a very small number. But in terms of what I expect from the government is that somehow there has to be the WHO classifies infertility as a disease, and hence the government needs to work on some insurance policies for to cover 3 cycles of insurance, 3 cycles of IVF at least in the insurance cover, which will help that population of people who are unable to afford the treatment. Mind it that even if I say that we are working for a common mass, or we have made the IVF treatment affordable, it is still costly. It still costs around 1.5 to 2 lakh, and then there are costs for the whole 9 month and then delivery, and some of the patient might require an ICU treatment also for the babies. So it's a lot of cost that the couple has to bear. So I think this is one factor that they should do. The second factor what I expect is that government has tried to open up few IVF centers in AIMS and few colleges, but the number of cycles they have been doing is very less. So I think there is a big need of this private public PPP partnership which the government can do. So the government should try to subsidize in terms of the cost to the patient, and get a good partner in place who can make sure that the quality and the success rate and the treatment is at par with the international standard. So there is a big need for these PPP setups where the government standardizes and lowers or subsidizes the cost, so it becomes more affordable for these patients, and the private player brings in that expertise.
Indira IVF has been using technologies to not only bring efficiency to the practice, but to give the better outcome. We are already seeing a lot of AI, blockchain technologies being used in various fields. How are you using AI to make a difference to the service being offered?
Right. So very good question. I think there's a lot of hype about AI in the whole world. But what we are trying to do is that we have a lot of centers, and across the center, the people who work in the lab are called embryologists, right? So normally, when an IVF procedure is done, you have multiple embryos being formed. The embryologist will see those embryos in the microscope, grade them, and pick that I want to transfer one of two of these embryos, and then do a embryo transfer to the patient. That is the normal process. How AI plays a role is that AI, the different, if I give a same embryo to 10 different embryologists, they will grade it differently, right? So it's more human dependent, it's subjective. So AI brings in that objectivity into the system by grading the same embryo across the locations in the similar way. So with the AI system, we are able to achieve this standardization. And of course, compared to a new embryologist versus a seasoned embryologist, if a AI comes into place, the success rate or the prediction chances of picking the right embryo increases to a greater extent, and we are able to provide a higher success rate to the patient. That is one area where we are using a Life Whisper. We have already done a tie-up with Life Whisper, and we are using their technology to grade our embryos and predict the implantation rate, and then do the transfer according to that. The second area we are working with them is when we do a genetic analysis of a particular embryo, we take out a few cells from the embryo and then give it to a genetic lab for testing. Now, when we do this procedure, it is an invasive procedure which causes stress on the embryo and may damage the embryo. And also, it is more expensive procedure in terms of the biopsy that we do to take out the cell. And there is an additional level of freezing and thawing which is required. And there is a time delay that the report will come after 15 days, and then you have to transfer the patient in the next month, right? So all these factors are associated with invasive procedure and take out the cells. What we are trying to do again with AI is that if we can predict, looking at the embryo, the genetic nature of the embryo, we can somehow avoid all these disadvantage with the invasive procedure has, and you can achieve at a lower cost a quick result, and you can do an embryo transfer then and there of the patient. So we are working with again Life Whisper for them. So we have done a initial pilot project, and we have achieved almost a concordance of 60%. Now more data goes into the system will automatically train itself and will be able to achieve a higher level of concordance. So I think these are the two factors which will aid to that. The third factor we are working is that because we have done so many large number of cases and we have almost gone to 1 lakh successful IVF pregnancies, we are trying to plug in that data into the system and apply AI into that. What we are trying to achieve out of it is how it happens in the cancer treatment also, that if you plug in a few parameters or test values of the female and the male, the machine should do the calculation and should be able to suggest a protocol which needs to be used for a particular patient. What is the dosage of the injection that you need to use for growing of the eggs, and how much is the duration of that thing? That is what we are working currently and put AI into place. So I think these are the three broader areas where AI can play a bigger role when it comes to the treatment, and all the monkey work which a doctor should not do is done by the machine.
I think that's a brilliant, brilliant initiative because it's not just, I mean, if you have done 100,000 IVFs till date, there's a huge data which is already available with you to give you a sense of what has worked and what has not worked. Brilliant. But when we look at the market size, we understand that, India itself is providing a very huge market opportunity for ART treatments. But when we look at the international market, and India is the destination that a lot of people look for quality and affordable healthcare, is that a case for IVF as well?
So India has really shaped up in the last 1 decade. I mean, if I talk about the pricing of the IVF, we probably would be the cheapest in the world. If we talk about the quality of the treatment and the infrastructure, India has come a long way. And if you see hospitals or healthcare setups in India, and also the IVF centers in India, we are at par with international standard. So which becomes a very attractive combination to attract patients from abroad. Um, in terms of areas where we get patients from, so Bangladesh is one area, Nepal, Sri Lanka, Africa, and Afghanistan. These are the mainly areas where these patients they flock in India to get an IVF treatment done.
So when you look at the international market, we know that a lot of people are coming to India. Does Indira IVF have plans to go overseas? I mean, you in the past history, you've shown that when patients were coming from different places, you opened up centers there. Is that something that you would do for the international market as well?
Yeah, we want to grow across the geography globally. So we have right now we want to see a bit of flavor. We are in the next 6 to 8 months we will be opening centers in Nepal and Bangladesh to start with Kathmandu and Dhaka, and then see across how we can expand within the geography, and then take a sense of how well we do internationally and gain knowledge and the technical expertise in terms of how to run the operation internationally sitting in India. Once we get a flavor of that, I mean, South again, as per the Allied report, the Asia will be doing, or the growth of Asian market in terms of the IVF cycles will be the highest in the world, right? So the Asia will grow somewhere around 11 to 12% CAGR in the next 5 years. So we will be targeting the Southeast Asia, which is mainly Indonesia, Vietnam, Philippines. I think there is still a scope of another player coming in, which brings in the expertise and demonstrate what we have done in India and bring take that, go outside and do an expansion in these geographies.
So, Dr. Murdia, the question that comes in my mind is that when you look at setting up a center overseas in those countries, wouldn't the local, challenges or pricing, etc., come into play, and you lose that competitive advantage that you would have with other players who already exist there versus offering the treatment in India?
No, so what I feel is that, as I told you, India is the lowest in terms of the pricing of the IVF in the whole world. This gives us an advantage that we can be profitable even doing at a lower prices, and we can sustain our operations ourselves, even offering at a low cost IVF. This tells us that we are efficiently able to manage our workforce, our operations, and the way we run things in India. And that is why we are able to offer at that price range, which others might not be able to offer. And I think the same thing is required even outside India. So if I compare Bangladesh versus India, the cost of treatment in Bangladesh is higher than India, and the success rate would be half compared to that of India. And that is why you see a huge amount of couples from Bangladesh flock in India in West Bengal and Chennai and Delhi, which tells us that there is a huge market there. But what we are trying to do is again, go to our core strength, which is affordable treatment, and give the same level of quality and success. We have a very robust training center, and all the expansion we are able to do in India is because of the training facility that is available at Udaipur. So we will of course be recruiting the local people, getting them here in Udaipur, training them to our standard protocol systems, and then place them there so that they can replicate the same level of success and the quality that we are able to do it in India.
So, if I were to hear what you just said, does this mean that there is a challenge in terms of finding the right trained professionals in the country, something that you are able to manage because of your own training center?
So when we started in 2011, there were few bunch of doctors only who knew IVF, right? It was something like it is only available in metros. But eventually we realized that IVF can be broken down into simpler step, and doctors can be trained and they can replicate the same amount of quality and the success. When we went and looked across the market, we could not find IVF specialists. There were very few, or very, you can count it on your fingers. So then we designed this training setup. We got, young people, young gynecologists passing from, just pass outs, get them here, train them, and then do them. So what expansion, or the fast expansion we did from 2015 to 2021, 22 is because of the training center, because we were able to erect those IVF specialists, which can give the same level of quality of treatment that we are able to give it in Udaipur.
So, does this training center cater to just your own internal consumption, or you train people who can go work anywhere else as well?
So initially we were doing it for ourselves because we were expanding, crazily, and we were very busy in terms of training people. Lately, we have opened up for international doctors also. So we have a tie-up with Merck Foundation Egypt. So every quarter we get around 8 to 10 doctors from Africa, Philippines, Bangladesh, Nepal, Sri Lanka, and other places. Recently, we have also opened it up for the domestic market. We have started the fellowship courses. As per the ART law, you need to have training of 1 year for the embryologist. So we have done it for the clinical doctors as well as the embryologists. So now it is open for domestic market also.
Lovely, lovely. So, one thing that pandemic has taught us in the corporate world is that you need to take care of your workforce. And the reason, I'm bringing this up is because, like you said, that IVF or infertility per se is a very emotionally draining situation for the couple, and especially for the ladies. Now, and this is also financially draining because it's an expensive treatment. Even while it is affordable, it is still an expensive treatment. Do you
Right.
think more and more corporates should start including covering of this treatment as a health benefit for the employees? And also, you had mentioned that your one of your ask is for the government to mandate that this should be covered under insurance. What is the view of the insurance industry on being able to cover infertility treatment under their policies?
Okay. So let us first start with your first question, corporates. How can corporate address this thing? So there are a lot of corporates which are, internationally, like Apple, Google. These are the, people who cover ART treatment for their employees. So that acts as a pull for people that we are able to provide you that benefit and join us. I think the same has to come back to India also, and I feel that infertility, because of what the couple goes through, it can affect the output of any particular employee in your particular company. And that is why this ART or the whole assisted reproductive technology treatment has to be covered as a corporate policy. This will obviously edge over the other companies in terms of attracting people, because infertility has become very common now. And if you see, even in your family and circle, you will see every third person has some problem, may not require IVF treatment, but require some kind of treatment or counseling to be able to conceive. So that takes care of the first question that asked. The second question is the insurance. So see, the problem is when it comes to the government employees, they have a cover of around 60,000 per cycle, up to they can go up to 3 cycles, which is even patients who are undergoing IVF cycle in AIMS, they can they are able to get a cycle at 60,000, which again the government has subsidized the cost, and that is why the treatment is available at that level. In terms of the insurance companies, I don't think that product exists as of now. So it has to be driven through the IRDA. They need to make a product like this, and then the insurance company should be able to do it. Again, the only problem that I see is two issues with the insurance company. There is always a cooling off period. Now, when it comes to infertility, people are not um, very proactive in taking the cover for infertility, because I think there is a lack of awareness and knowledge that exists in the market. The second thing is, um, when a patient comes or visits the IVF center, he wants to get the treatment done now. So he can't wait for 1 year or 2 year, which is the cooling off period, which is available, in the normal insurance policies. The second thing that I see is that I feel that insurance policies, I mean, because this is as per my talk with few of the insurance companies, they want to cover the IVF cycle which is successful. Now, when it comes to IVF cycles, there will be success, there will be failure, right? So when they have to cover, it has to be the IVF cycles, not a successful or unsuccessful IVF cycle. So these are the two aspects which I feel the insurance companies need to tackle, and IRDA has to come in and make a product so that insurance companies can offer.
Right. Now, recently we saw, I mean, last year we had the new Surrogacy Act passed. You know, can you explain what the new Surrogacy Act is that was passed in 2021? What are the pros and cons of this act?
Okay, so just to go a bit historical, the ART Act is, being there since 2004. It was supposed to pass, since 2004, but it has not been passed. So in 2019, the Surrogacy Act was passed initially, and then it went to the lower house, and the lower house said that for a surrogacy to happen, the ART treatment has to happen. So the ART law has to be passed before the surrogacy law. And then in 2021, both the laws were passed together, right? Speaking about the surrogacy law, the only thing I feel it it says is that the surrogacy has to be altruistic. It cannot be commercial. There were a few cases of exploitation of women, which I think have happened in the past, and due to which the government is of the opinion that we need to stop it, because there were a lot of foreign couples coming to India, and the Indian surrogate mothers conceiving their child and giving it to them, and it just became like a profession for agents, for the surrogates, and for the clinics. So the government wanted to regulate this procedure and this process, and that is why the law came in. And now it is only the altruistic surrogacy which is allowed. There is no commercial surrogacy which involves payment of the money to the surrogate. It's completely banned.
Now, the reason why I see this, law coming into place, like you just mentioned, the surrogacy, as well as the insurance companies, not wanting to fund the failed cycles, it could be because they want to safeguard themselves against the malpractices that could be happening in the industry. Now, what are some of the malpractices that you have seen happening in the industry, and what do you think needs to be done about that?
So I think the malpractices, it's difficult to comment because, the data is not available as of now with what people are doing and how many clinics even exist in the country. Nobody knows. Uh, um, but the ART law is also into place. The primary objective of the ART law is again to regulate all these IVF or fertility clinics. There is level 1 and level 2 defined in the law, and also to do an audit to make sure that the infrastructure, the manpower, and the equipment is as per the standard, and all the data will eventually be reported in the national registry, which is being made as of now. So once all this data is reported, once you raise the standard in terms of the infrastructure, manpower, and the equipment, I think the malpractices which may be happening in the past will, come to or minimize to almost zero with this law in place.
Dr. Nitiz, central government has recently appointed you as a member of the National Assisted Reproductive and Surrogacy Board. How do you intend to use this position to create an impact for the industry?
So, so when the law passed, there were a lot of disgruntled IVF clinics. Of course, any change is not appreciated by anyone. That obviously happens. So I see my role, as a bridge between the IVF clinics and the government authorities. Um, Somehow try to match up the level of expectation, keeping in mind what the law has been passed. There are a different interpretation which, the government would interpret the law and the way the clinics would interpret the law. I want to bridge that gap, do more, workshops, do more uh, interactions with clinics, with doctors, try to make them understand that what is the government objective of, bringing a law like this, what is that they want to achieve out of this law, and within the boundaries of the law, what is that you can do and what is that you cannot do. Of course, the old practice will need to change slightly, uh, but at the end of the day, me as the board member, I want to make sure of only one thing, that the treatment which the end person or the patient is getting, uh, he is the most important person in this whole change because he is the end user. He should not be cheated. There should be complete transparency and ethical nature of the treatment being given to the patient. And it should not increase the cost just because of a regulation, things get inflated. It should not happen. And as well as clinics, they need to understand what are the boundaries of the law and they can operate within the boundaries of the law. And if there's anything which is completely contrary to what the medical nature says, I will of course highlight it with the authority and try to see that if we can bring some changes required in the whole policy of this ART or the surrogacy law. So that is what I see as a, myself as a bridge between the two.
Lovely. Dr. Murdia, my last question to you is, uh, we understand that the market is huge. Uh, is there space for more players to come in? One. Second is, what is it that we can expect from Indira IVF in the next 1 year or 2 years? Are there some acquisitions lined up? Is there more funding that is going to come in? What is the future of Indira IVF in the near future?
To answer your first part of the question, I think there are already a few chains who are expanding across India, and there are, I think, 3, 4 active chains who are already opening centers across the length and breadth of India. So obviously they see that there is a potential, to capture that underpenetrated market, and that is why people are opening centers in India. In terms of Indra IVF, as I told you that we are very strong in the north and the west, and there is a need for us to expand more into the southern market and the eastern market. So which is our plan to go and do these kind of expansion. Also, we are looking at acquisitions in the southern market, especially the Kerala market. So we are looking for doing a inorganic acquisition in that particular market. We are also open, for Tamil Nadu market. If there is a smaller chain, and if we see synergies between us, how can we do acquisition of that particular chain and across and spread it across the Tamil Nadu. We would be keen on that aspect also. So that is in terms of our expansion in the country organically and inorganically.
Thank you so much, Dr. Nitiz Murdia, for speaking to us. It has been such a pleasure listening to your perception about the industry and where do we see the industry growing. Thank you for your time.
Thank you, Harbinder. It has been absolute pleasure, and I would really appreciate the quality of the questions that you have asked me. Thank you very much for having me on this platform.
It's a pleasure.